Hello, this is Pi Project for Class 3B, Senior 25. Our members are Malak Muhammad Mustafa, Amy Bshoy, Rufaida Ashraf, Merit Nashat, and Ihsan Walid.
Good morning, Emmy. Please have a seat. So you've been experiencing stomach pain. Tell me about it.
Yes, doctor, it's a burning sensation, mostly in the middle of my stomach, right here. It comes and goes, but has been happening almost daily for a while.
And when does it usually occur?
It's often worse when my stomach is empty, like before breakfast or late at night. Eating sometimes makes me feel a bit better, but it comes back later. I have been feeling bloated and a bit nauseous.
Any other symptoms? Have you noticed any change in your stool, like black or tarry stools?
No, nothing like that, but I do get heartburn sometimes, and I have been burping a lot.
Do you take any pain relievers regularly, like ibuprofen or aspirin?
Yes, I take ibuprofen for headaches occasionally, and I have been under a lot of stress lately with work and deadline and all.
I see. Do you smoke or drink alcohol?
I have few beers on weekends and I used to smoke, but I quit a few years ago.
Based on your symptoms, it sounds like you might have a peptic ulcer. We'll need to do some tests to confirm. I would like to order a blood test to check for Helicobacter pylori bacteria, and we'll also schedule an endoscopy.
An endoscopy? What is that?
A procedure where we insert thin flexible tube with a camera down your throat to examine your stomach and duodenum. This will allow us to see if there are any bacteria.
Okay, that sounds a bit scary, but I understand. What about treatment?
If H. pylori is present, we'll treat it with a combination of antibiotics and proton pump inhibitor, which reduce stomach acid. If it's not H. pylori, we'll still use proton pump inhibitors and other medication to help heal the ulcer. We'll also discuss lifestyle changes such as avoiding certain food and managing stress.
Thank you, Dr. Rufaida. I appreciate you explaining everything.
What is a peptic ulcer? A peptic ulcer is a sore that develops on the lining of the stomach, gastric ulcer, or the first part of the small intestine, duodenal ulcer. These ulcers occur when the stomach acid damages the lining of the digestive tract.
Helicobacter pylori infection. This bacteria is the major cause of peptic ulcers. It weakens the protective mucous lining of the stomach and duodenum, allowing acid to get through the sensitive line beneath. Long-term use of non-steroidal anti-inflammatory drugs. Regular use of pain relievers like ibuprofen, aspirin, and naproxen can irritate and erode the lining of the stomach and small intestine. Excessive stomach acid production. While less common, conditions that cause excessive acid production can contribute to ulcer formation. Smoking increase the risk of peptic ulcers.
Excessive alcohol consumption can irritate the stomach lining. Stress, while stress itself doesn't cause ulcer, it can worsen symptoms. Burning stomach pain, often described as gnawing or burning sensation in the upper abdomen. Pain that's worse on an empty stomach. Pain can be relieved temporarily by eating certain foods that buffer stomach acid, or by taking antacid, bloating, heartburn, nausea, or vomiting dark. Tarry stools, a sign of bleeding, weight loss, change in appetite.
Endoscopy, a procedure where a thin, flexible tube with a camera is inserted into the esophagus, stomach, and the duodenum to visualize the lining and take tissue samples. H. pylori testing, blood, stool, or breath tests can detect the presence of H. pylori bacterium. Barium swallow, X-ray imaging of the esophagus, stomach, and the duodenum after swallowing a barium solution.
Antibiotics to eradicate H. pylori infection. Proton pump inhibitor, medications that reduce acid production. H2 blockers also reduce the stomach acid production. Antacids provide temporary relief by neutralizing stomach acid. Lifestyle change: avoiding smoking, limiting alcohol consumption, and managing stress. Avoid non-steroidal anti-inflammatory drugs when possible.